José, thank you so much for having accepted this invitation to have a quick chat with me. I'm here this afternoon with José Fermoso, Senior Researcher in CARTIF and also Project Coordinator of the K-HEALTHinAIR project, with whom we will have a little chat to understand which is the status of the various pilot sites that we have involved in the project. These pilot sites are dealing with different scenarios and different measurements, so please just tell us something more.
Okay, maybe as a brief summary of the different scenarios that we have within the project. In the Spanish scenario, in Barcelona, we have 4 very different scenario settings, like a hospital, a clinic hospital in Barcelona, a metro station, a city market, and also we have outpatients home. These are outpatients with lung diseases or lung problems selected from the hospital, and it's a nice scenario with very interesting results we will get. In the second pilot in Rotterdam, we are working with another hospital, the Erasmus Medical Center, and also with homes with outpatients and elderly or senior homes. We are collecting. Then in Norway, our pilot number 3, we are in that focusing our studies in the university, with a canteen there, a lecture hall, but also some rooms used by the students there. So we focus our studies on this. And in some way, in parallel, in Germany, our pilot number 4, we are also studying, monitoring, and sampling different parameters in Germany in a canteen. In that case, or in this case, industrial canteen from one big company, and also a lecture hall in the hospital, in the university there. And finally, our pilot number 5, that is in Poland and Austria. We are focusing in schools and also in homes with different heating systems, and we will be studying the impact of the heating system on the air quality and of the home.
So it's very, very different settings and very different population that is under studying. Let's say, let's talk with in relation to the one really more close to hospitals and nursing homes, and so there we have patients and outpatients as well, because now in Barcelona, you said there is also the metropolitan station, and it's just in front of the hospital where these outpatients maybe go in and out. Do you have any preliminary findings there already?
Well, we are studying. We are still studying the data from the analysis, and we are finding some preliminary results. But in some way, we are finding that there is maybe a correlation between the exacerbations from these outpatients with the indoor air quality, but they are very preliminary data that we are still working on the analysis, and we should continue working on monitoring the information to get more detailed results. But they are promising. At this stage. Yeah.
And what about the other categories of the population involved? We have been talking about schools children, for example, but also the elderly. Which have been the main challenges in involving them in the study, and what do you wish for, let's say, on this population?
Yeah, always is challenging involving people, especially in this kind of topics, even when maybe you can consider that it's important, because everybody can suppose that the air quality affects health or could affect health. But then involving the studies requires in some way to teach or to aware there about their potential results, how they are going to get benefits from the study, and maybe in that case for seniors in the senior home, it requires maybe a slower work, or slower or more patient maybe to explain the reasons behind the study that we are proposing. And maybe also the students for example, in Norway, students from the university is always challenging, try to involve them, and our colleagues they even could they offer them give cards just to try to bring them to the study, and it's quite challenging.
It's
At the end,
challenging.
it works, but it supposes a lot of work and time.
And just out of curiosity, which kind of devices are you using to track the measurements? For example, I would say the personal one, if I don't know if you are using any smartwatch or things similar to that, to assess, let's say, the health status of the population involved in the study. And on the other side, are you promoting or using any purifying or ventilation system within the pilot to try to assess which is the impact of this kind of tools, really?
Yes. Well, in order to assess the indoor air quality, we are using monitor tools from two manufacturers that are directly involved in the project, in Biot and Manns & Hummel. And they both devices are being used in all of our settings to continuous monitoring the indoor air quality for long period. In some of the cases, more than 2 years.
Okay.
And then with the patients, we are using oscillometry, also bracelets with health status. But we are correlating this data with the indoor air quality, and it's challenging until now to get results. But we are working on it. And another means, and also regarding the solution filtering, and we are right now testing the solution in homes and school in both in Poland and in Austria, but we are just doing we are performing the study right now, and we hope to get very good results, because in some way we can suspect that it works. But,
it works.
Yeah.
So what is next? Let's say in the next near future, which are the main activities that you think you will implement, but also which are the preliminary results? I mean, you already said that some preliminary results are already there, but what you wish to achieve, for example, in the next 6 months?
From my point of view, maybe the most important part is the discussions that we are performing right now within all the pilots is how we can analyze the data that we are collecting from the monitoring tools, and supplement this information that can provide these tools with the sampling and the other information that we are collecting in the pilots, in order to create protocols or where to analyze the data and try to highlight what could be the settings of the scenarios that could be in some way in risk, and try to find a good way to identify these spaces, and try to promote or to generate or to create clear messages according the user of each space, in order to improve the indoor air quality and the health.
Thank you very much. So for the public, for sure, we will keep our media channels updated in the next future, and we are eager to publish some more information and some more results about the pilot sites implementation activities. Thank you, Jose. Thank you so much.